So after talking about some male sexual dysfunctions, let's talk about now the female sexual dysfunction. In this, we will talk about the epidemiology and physiology of female sexual dysfunction, risk factors that can lead to female sexual dysfunction, how we can treat this condition, and how we can approach to the patient who have the sexual dysfunction in females. So female sexual dysfunction is a hypoactive sexual desire disorder. So hypoactive sexual disorder is due to sexual pain disorder. So if the females experience pain during the intercourse, that can cause sexual dysfunction, and it's known as, or it comes under hypoactive sexual desire disorder. Also sexual arousal disorder and the orgasmic disorder. So all these three conditions comes under the female sexual dysfunction. The organic causes of female sexual dysfunction include the neurological problems. Then we have cardiovascular diseases is another cause, cancer, gynecological cancers, urogynecological pathologies, and drugs, hormonal disorders. So all these are very common conditions that can cause the female sexual dysfunction, and these are all the organic causes of female sexual dysfunction. Then some psychological causes include if the patient has anxiety, depression, history of sexual and physical assault, stress, alcohol or drug addiction. So these are psychological causes of the sexual dysfunction in females. Then relationship level. If there is partner performance, loss of partner, quality of relation, and loss of specialness, all these are the problems at the relationship level. If the relationship between the partners is not good, it affects the sexual dysfunction and sexual desire. Then some socio-cultural factors include inadequate education, conflict with religious, personal, family values, and social taboos. So all these are the common factors that can lead to sexual dysfunction in the females. Epidemiology is 43% of women complain at least one sexual problem. Desire and arousal phase disorders are most common. So in the men, usually when we talk, erectile dysfunction is the most common sexual dysfunction in the men, and in the females, usually the desire and arousal phase is most common disorder. Physiology of female sexual response. Here we have stimulate sexual response. There are some factors that stimulate the sexual response, while there is another factors that inhibit the sexual response. So the factors that stimulate them, we have alpha MSH, which is melanocyte stimulating hormone, dopamine, estrogen, oxytocin, progesterone, testosterone. All these are different hormones. These can affect or stimulate the desire in the female sex response. Then we have again alpha, MSH, dopamine, norepinephrine, oxytocin. These cause the subjective excitement. And then also norepinephrine, oxytocin, they can increase the orgasm. So these are some hormones which stimulate the sexual response. Then as compared to them, serotonin, prolactin and serotonin, they inhibit the sexual response. And we have another dopamine, estrogen, testosterone, cholinergic fibers, nitric oxide, norepinephrine, prostaglandin E1, and VIP, which is vasoactive intestinal polypeptides, and then cholinergic fibers. These are also some factors that can stimulate the sexual response as compared prolactin, serotonin, sympathetic fibers, they inhibit the response. So mainly serotonin, prolactin cause inhibition, and then other hormones, dopamine, we have MSH, estrogen, progesterone, testosterone, all have the stimulating effect on the female sexual response. So now there's some risk factors which are associated with the sexual dysfunction in females. We have the neurological diseases, and in the neurological diseases, stroke can cause dysfunction, and spinal cord injury can cause female sexual dysfunction. Parkinsonism disease can cause sexual dysfunction. Another trauma is another risk factors in which we have genital surgery, radiation therapy, endocrinopathies including diabetes and hyperprolactinemia causes increased prolactin hormone, and increased prolactin, as we saw in the previous slide, it causes inhibition of the sexual response. So if there is increased prolactin level, there is decreased desire, or there is sexual dysfunction. Then liver or renal failure, cardiovascular diseases, psychological factors, and interpersonal relation disorders. Like sexual abuse, if the female has a history of sexual abuse, then it affects the sexual function or sexual desire of the female. Life stresses is another risk factor. Then some medications, as we discussed, so many medications that affect the males. Similarly, different medications also have effect on the female sexual desire. And these include anti-androgens and anti-estrogens or gonadotropin releasing hormone antagonist, antihistamine. So all these are the drugs that can affect the sexual desire in the females, and antihypertensive. Approach to the patient: address mood disorder, low self-image. Mood disorders, depression, anxiety are the psychological issues that can affect the sexual desire in the females. Address interpersonal issues, relationship between the partners is another very, very important factors affecting the interest. Then psychosexual education, women's sexual response cycle. Create this patient's sex response cycle showing interruptions, point of vulnerability. Conflicts from early life precluding intimate relationship psychotherapy. Self-monitoring distractions, anxiety, undue focus on or genital sex, poor communication, sex therapy. Sexual anxiety, catastrophic distractions, learn dissociation, mindfulness, cognitive behavioral therapy. Reduce genital sexual sensitivity, reduce lubrication, vaginal or systemic estrogen or investigation vaginal DHEA. So all these are the different management steps or approach to the patient. Create the patient's sex response chart and then tell them what stage is affected, and then treat the patient according to the stage at which the patient is more vulnerable to the disorder. Other treatment options, oral agents like PDE5I, a clitoral vacuum device in patient with arousal and orgasmic difficulties, a clitoral vacuum device, handheld battery operated device. And this is the picture of the clitoral vacuum device. So this was all about our section of female sexual dysfunction. Thank you for watching sqadia.com.